Hi students, good evening. Today we're going to be talking about intra-aortic balloon pump therapy. So exactly what is an intra-aortic balloon pump, or an IABP? It is essentially a mechanical circulatory assist device. It's for our cardiac patients and helps to support cardiac function. It is utilized for cardiogenic shock patients, and cardiogenic shock is one of the most difficult types of shock to treat and has a hospital mortality rate of 50%. The intra-aortic balloon pump is also temporarily used along with pharmacological interventions to help improve cardiac function and is mainly used for patients in cardiogenic shock. So let's just quickly pause for a minute and just briefly go over the topic of cardiogenic shock. So cardiogenic shock occurs when the heart fails to act as an effective pump. So this basically means that the myocardium, or the heart muscles, are unable to contract effectively, which leads to a decrease in cardiac output and impairs overall tissue perfusion. So in order to understand the physiology behind the intra-aortic balloon pump therapy, it is important to cover the topics of a few different cardiac dynamics first. And what I mean by cardiac dynamics is more specifically cardiac output and stroke volume. So what exactly determines cardiac output? So if you look at the formula here on the lower right-hand corner, cardiac output is equal to heart rate and stroke volume. So simply put, cardiac output is the amount of blood the heart pumps in 1 full minute. And how is stroke volume then determined? So stroke volume is determined by preload, afterload, and contractility. So when you think of preload, when you look over here on this image on the right, on the image on the right, we're thinking volume. So it's the volume of blood in the ventricles by the end of diastole. So basically the volume when the chamber has filled up prior to contraction. So it's essentially the pressure in the ventricles as the heart fills with blood. So secondly, we have afterload. So when we think afterload, I want you to think of resistance. So afterload is a resistance that the left ventricle must overcome in order to circulate blood throughout the body. So in more technical terms, it is a pressure that the heart must overcome in order to empty the ventricles effectively. And so when there's damage to the myocardium or the heart muscles, the force of contraction is unfortunately decreased. Therefore, because contractility is directly correlated with stroke volume is then also decreased as well. So in this case, stroke volume decreases. So if we go back to this slide here, stroke volume on this right-hand corner, if that decreases, this actually directly affects the cardiac output. And therefore, the overall cardiac output is also decreased. So with the reduced cardiac output, this causes a decrease in blood pressure or hypotension. And this leads to a reflex compensatory mechanism in our body where vasoconstriction occurs in the peripheral vascular system. And because of the vasoconstriction, if you imagine a hose and it's shrunk in size in diameter, there's greater pressure through that hose. So this ultimately increases afterload. All right, so if we go on, here we go back to our intra-aortic balloon pump therapy, and specifically for cardiogenic shock patients. So I just want you guys to have an understanding of what the key functions are of this balloon pump therapy. So the main 2 takeaways for utilizing the balloon pump therapy is to allow for afterload reduction, so basically a decrease in systemic vascular resistance, and also to improve coronary artery perfusion, which leads to a decrease in ischemia and other symptoms, so it can help to relieve chest pain and ST segment elevation. So because this balloon pump therapy is able to do both of these functions, reducing afterload and improving coronary artery perfusion, this actually helps to ultimately increase stroke volume for the patient and in turn helps to increase the overall cardiac output, therefore perfusing all the tissues in the body in an effective manner. So we can quickly touch on some of the other indications for balloon pump therapy. It is utilized in other situations besides cardiogenic shock sometimes. So here in the cardiac ICU, we see balloon pumps utilized in patients that have unstable angina. So these patients are usually receiving maximal medical therapy, but even despite receiving the maximal medical therapy, they are still in need of further cardiac support. So this is where the balloon pump comes in. So the balloon pump is utilized here to stabilize patients who are waiting on procedures such as a PCI, which is a percutaneous coronary intervention where a stent is placed for blocked coronary arteries. This type of therapy also allows patients to get stabilized prior to a CABG or a coronary artery bypass graft, a surgery, or even a heart transplant. So the patient may be experiencing unstable angina, and therefore the balloon pump is used to reduce or eliminate symptoms and support the patient for preparation for surgery or revascularization. Another indication is for a patient who's had a myocardial infarction, and because of that, the balloon pump can be used here as a preventative measure for persistent ischemia and reinfarction. And lastly, somebody who's had a heart attack, they may develop mitral regurgitation after the fact, and this type of balloon therapy can actually help to decrease afterload and help to diminish the regurgitant blood flow. So how does the balloon pump actually work visually? So here you have on the right-hand side here, you see that the balloon pump actually rests in the patient's descending aorta right along this vessel. So the balloon pump therapy here is initiated by inserting a dual chamber balloon, as shown here in the photo, through the femoral artery. So down on the left-hand side here, this is where they go in, and then they string the balloon up into the descending aorta. So the balloon is inserted percutaneously and can be done at bedside or under fluoroscopy. So the tip of the balloon, if we go to the next slide, tip of the balloon here is, if you look here, this is a subclavian artery, and right over here, the balloon sits right distally to the left subclavian artery and proximal, so right above the renal artery. When we go back to the previous slide, the machine console here that is attached to the balloon helps to coordinate the inflation and deflation of the balloon. So this is a very important point that I want you guys to hone in on. So when we think of inflation of this balloon, we're thinking increased perfusion. So how does that actually work? So the balloon pump inflates, so as shown here in A, during diastole. So when the heart is filling with blood, the balloon actually inflates, and this pushes the blood and displaces the blood backwards up into the coronary arteries like so, and also down forward simultaneously, which leads to perfusion to the vital organs. So the benefit of the inflation is basically increased perfusion to the coronary arteries and to the other vital organs. Lastly, deflation. So that is actually the opposite. So right before systole, the balloon deflates here in B, and that allows the sudden deflation and displacement of that blood that occurred during diastole, helps to reduce the pressure, total pressure in the aorta, and decreases afterload and myocardial oxygen demand. So it helps to decrease afterload and also thereby decreasing the oxygen demand that the heart needs. All right, and lastly, these are just my references. This is just a portion of the entire module, but these are my reference slides. Thank you so much, and Have a good evening.